Four activity statements were added to the test plan based on SME panel recommendations and results of the practice analysis. The first addition was provide care for a client experiencing grief or loss. This was added to psychosocial integrity.
Based on this information, we're going to do a question on grief and loss today and select all that apply, and we're going to use the Clinical Judgement Model to answer the question. So let's get started. A 79-year-old is admitted again for heart failure and kidney failure. After completing his admission, the nurse is talking with the client's wife, who expressed several concerns. She says, "I know he doesn't want to die in the hospital, but it is so hard to take care of him at home. He said he doesn't want any more treatment, but I'm not ready to let him go. We have so many arrangements to decide before he dies. Which of the following interventions with the client's wife would be most appropriate? Select all that apply." The first step in the clinical judgment model is to recognize cues, and then we want to analyze the cues. So looking at the question, we have heart failure, that's a cue. Kidney failure, that's a cue. It says, after completing his admission, the nurse is talking with the client's wife. So now, heart failure and kidney failure is no longer a cue. Now we want to focus on what the client's wife is saying. She expressed several concerns. So now her concerns are going to be a cue, right? I know he doesn't want to die in the hospital is a cue. But it's so hard for me to take care of him at home. That's a cue. He doesn't want any more treatment. Okay, so he doesn't want to die in the hospital. He doesn't want any more treatment. But she's not ready to let him go. That is a cue. So far, the cues are focused on the wife. The wife knows he doesn't want to die in the hospital. It's hard for her to take care of him at home. He doesn't want any more treatment. She's not ready to let him go. These are our cues for this question. So it's important that you write the cues down. That's the important thing. The second step was that we analyzed the cues. We analyzed these cues and we knew that him being admitted to the hospital with heart failure could be thrown out. We knew that his kidney failure could be thrown out. We analyzed our cues and we know to focus on the wife because she has so many arrangements to decide before he dies. And then the question goes on to ask, which of the following interventions with the client's wife would be most appropriate? Select all that apply. So, because of our cues, we recognize them, we analyze them, we know that we're going to come up with solutions, and all of our solutions will point to interventions for the wife. Now, what did I say about solutions? Solutions are the third step in the clinical judgment model way of thinking. All of your solutions want to achieve the end result. So, when we come up with solutions based on our cues to formulate interventions, they should all be geared toward helping the wife cope with her husband's situation. So all of our actions in the select all that apply should be geared towards helping the wife cope with her husband's situation in a therapeutic manner. So the third step in the clinical judgment model is to generate solutions. In this case, we want all of our solutions to be therapeutic to our client's wife. So keeping in mind that our fourth step, taking action, is therapeutic to our client's wife. So let's read our choices. So which of the following interventions with the client's wife would be most appropriate? Select all that apply. So everything that we select has to be therapeutic to the client's wife. 1. He is not going to die that soon, judging by his current symptoms. If we said this to her, would this be therapeutic? No, it would not. It wouldn't change her situation in the least. It wouldn't get rid of any of her concerns in the least. So let's not pick it. Choice number 2. What are your fears about your husband dying? Think to yourself, if we asked her this, would it be helpful to the wife? And the answer is yes. It would get her to talk to us so that we could help her, right? So let's choose number 2. Number 3, I can imagine that it is hard for you to take care of him at home. This is a good thing. This shows that the wife, if we said this to the wife, this would show to the wife that we are empathetic to her needs and not just sympathetic. So yes, I would pick 3. So far I would pick 2 and 3. Number 4. What do you and your husband know about advanced directives? Now the husband knows he's going to die, right? Heart failure, kidney failure, doesn't want any more treatment. So asking this question would be a good thing. If you have not listened to my advanced directives video, please do so, and I'll post it here in the description below. But part of the advanced directives is not just the healthcare proxy, but the living will and the will. So asking her this question would be a good thing. It would be helpful to her. So I would choose 4. Number 5, we can discuss types of hospice and home care available. This would be helpful to the wife because she already mentioned that it's hard for her to take care of him at home. So this would be a helpful solution to the wife. Remember, you want all of your solutions to point to positive interventions in helping the wife, right? And so I would pick number 5. And number 6, what type of arrangements do you think you need to make before he dies? This would be helpful to the wife because she said, we have so many arrangements we have to make before she dies. So this choice directly answers her fear of that concern. So the end result, my choices would be 2, 3, 4, 5, and 6 for this question. The rationale is as follows. With serious chronic and terminal illnesses, it is important to help clients and families address fears and difficulties with home care. Advanced directives, hospice, and home care options, and final arrangements. Now, I don't know if I thought about all that, but because I recognized the correct cues, then I analyzed the cues, I was able to, third, generate solutions that, fourth, allowed me to achieve the desired end result with my interventions or with my 4th actions, right? Remember I talked about taking action? And then the 5th step in analyzing and doing your questions is to evaluate. Did I answer all the, did I select all that apply, or did I answer the correct multiple choice question? So you always evaluate your answers to see if you think in your own mind that you got it correct, and then you move on to the next question. So very good. So this is another example of how to use clinical judgment when answering NCLEX questions.
Holy, holy, holy.